So something we've not really talked about. A lot of the work that I do is on very serious brain injury. People who have either had a traumatic brain injury or a stroke or some other event that has seriously affected their brain, and they've ended up in a coma or in a vegetative state. So these are not people who are mildly concussed. These are people who really have had a very serious brain injury. And what I do a lot of the time is to develop neuroimaging methods for trying to improve prognosis. That is, can we predict who's going to recover and who's likely to not recover? And also improve diagnosis, because it turns out a lot of these patients aren't in the situation we think they are. Just because a patient is not responding doesn't necessarily mean that they're not aware, for example. And the book, Into the Grey Zone, again, it's a popular science book, so anybody can read it. It sort of weaves together several different stories. One is the story of how we managed to show, and this happened in 2006, that some patients who are supposedly in a vegetative state are actually completely aware. They're aware of who they are, where they are, and the situation that they're in, despite the fact that even very experienced professionals, sometimes for decades, have assumed that they have no awareness at all. They don't know who they are and where they are. So it's a story of how we discovered that, and that was really almost a 20-year series of scientific investigations, working with different patients, and we gradually pulled the pieces apart and worked out how we could use brain imaging to show that some patients are aware. And we actually went on to communicate with several patients to get them to be able to talk to us, if you like, just by changing their patterns of activity in their brain.